This episode is brought to you by Banfield Pet Hospital and proudly sponsored by our friends at Zoetis, whose team of pet lovers, scientists, veterinarians, and more have dedicated over 70 years to advancing pet health.
Your call has been forwarded to an automatic voice message system.
Hannah Shaw
Is not available. At the tone, please record your message.
Hi, Hannah. This is Zoe from Chicago. I just adopted my very first dog and I'm honestly overwhelmed. How do I know which vet visits are urgent, what can wait, and how do I even start making a plan for my new dog's care?
What's the first thing you do when you bring home a new cat or dog? Do you snap a million photos, make them their own social media account, shop for some fun toys? Sure. But what about their first vet visit? For new adopters, discovering the ins and outs of vet care and how to build a real care plan can come with so many questions. That's why today I'm joined by Dr. Elizabeth Thompson, Chief of Staff at Banfield Pet Hospital, who helps families turn that first appointment into a foundation for lifelong health. Dr. Thompson is here to share the tools and tips that every new caregiver needs to keep their furry friend thriving long into their golden years. Dr. Thompson, welcome to Not Just Fluff.
Nice to talk to you, Hannah.
So you are a veterinarian, but I understand that you don't have any cats or dogs at home. You have fish, is that right? Tell me about life with fish.
That is true, Hannah. My household is made up of myself, my husband, who is terribly allergic to cats and dogs, 3 little kids, and a 10-gallon fish tank for freshwater fish. So we have plenty going on in our household, but not the pitter-patter of little feet is human feet only. So I get my fill at work with plenty of dogs and cats in my day job. But we did set up our freshwater tank just again recently after settling here in Atlanta. And my 6-year-old daughter is over the moon to not be petless, as she says.
Ah, that's cool. How many fish do you have?
We're just starting out, so trying to get through a few cycles, make sure that our water is healthy. So we have 6 little zebra danios and a cute snail named Sasha.
Oh, a snail. I love that. Okay. Well, today we're talking about managing vet care needs for your new cat or dog. I run a nonprofit that does a ton of adoptions, and I know that one thing I'm doing when I'm adoption counseling is talking about that first vet appointment. But can you talk about what happens after that? Once you've had your initial, new cat or dog appointment, what does vet care look like from then on?
Absolutely. That first appointment is the big one that everyone thinks about, right? But I think the biggest thing that needs to come out of that first appointment is an idea of when you need a next appointment. So, a lot of times, what we want to know from the first appointment is how often are we going to need some vet care and what do we need for the picture of the next year to come? So, ongoing care is going to be things like what is our plan to prevent the diseases that we can prevent? To control for parasites, to screen for our health and make sure it hasn't changed over the course of time. How are we going to check in as we get older, chubbier, as things change with our pet, and if things change in our household, like we add another pet or we add another child. So really, it's making sure that we've got a plan for how to reach out, who to reach out to, and when to see the veterinary provider next.
Are there certain things that are more essential to do in the first 30 days? And are there things that can wait?
I think we've hit on one of those classic it depends questions. We have to customize the care to the pet. And if we have a brand new puppy, I'm going to see you every 3 to 4 weeks for several months. We're going to have a lot to do and a lot to talk about to get those vaccines covered, to make sure that as you're growing, you have the appropriate parasite control. But if you are an adult dog and we've covered our bases in the first appointment to make sure we're up to date on preventive care, I don't have any new diagnoses or chronic conditions for you, then I'm going to build you a schedule for the year that includes a couple of visits. We know dogs and cats age a lot faster than we do, so an annual physical is not going to be sufficient to stay up to speed on what's happening with them. But we're going to build a different plan for a puppy versus an adult versus those tenderhearted people who have adopted a geriatric pet. There's going to be definitely a different cadence of diagnostics and care.
Yeah. So age definitely seems to play a big factor in kind of how you're planning out what vet care is going to look like and what prevention is going to look like for them. What role does lifestyle play in how you're recommending people do those routine appointments? Because I know that there's so many different ways that people live. Some of us are in tiny apartments, some of us are in big houses with a yard. You might have a ton of other animals at home, or maybe this is your only animal. What role does lifestyle play in what you're recommending for people?
Lifestyle is really important when we're building our plan for care for pets. This is a part of the history that we're taking now that dogs and cats are so integrated into our family lives, has a lot to do with what their family is like, who they live with, both dog, cat, gecko, fish, humans, and otherwise, and how they're going to spend their time. And so, beyond just how have they been eating and drinking, we're asking what are the activities that they do? How are they socialized? Where are the risks that we need to protect them from, and what are our goals for high quality of life for them, and how do we keep them doing those things, and the family maintaining that human animal bond and doing what they like together. So I think about lifestyle in all of those respects, but especially uh, the dynamic between the pet lover and the dog or cat. Are they elderly? Do they have little kids? uh, are they in a job that is 75% travel? What is the person up to on this end of the relationship that's going to lend itself more to helping us identify the lifestyle of their animal? So we think about what kind of exercise do they get, and where do they get that exercise? Is it an area with a lot of ticks? Is it in an area with a lot of dogs with unknown vaccine history? So we're thinking about dog parks, boarding facilities, hiking, whether they have other animals coming in and out. I've had clients who work as dog sitters, and they'll have other people's dogs in their home all the time. Even though that dog lives as the only dog in their home, they meet and socialize with other dogs frequently. If there are young kids in the home, as much as we want dogs to be protected against parasites, a lot of parasites are zoonotic, which means they affect people and animals. And a 2-year-old crawling on the ground is very susceptible to pass something uh, back and forth with a dog. And so it informs even more the high importance of certain steps we want to take to protect the dog and therefore protect the family.
I've always been a cat lady. I've had cats like my whole life. And last year, I adopted my first dog. She is a little Chihuahua. And uh, having her in my life has forced me to kind of find out, okay, what kind of dog person am I? And what kind of dog have I adopted? And, what does our lifestyle look like together? And I love hiking and going to nature reserves. And fortunately, my little Chihuahua is very outdoor motivated. So we'll go hiking together. And it was really interesting because in taking her to the vet and sharing that with them, I learned about dangers that I had never heard of because they weren't really applicable to my indoor cats. Can you talk about some of the things that maybe somebody listening like me, maybe they're new to having a dog, like what should they be thinking of if their dog is walking through puddles in a nature reserve and, going into areas with wild animals?
Sure. And one thing I want to say for you and your cat is your cats are now a little bit outdoor cats because they have a very close friend who goes outside and brings things in the house. And so the lifestyle of your cats changes when a dog joins the family as well. For dogs who are outside, we are thinking about their exposure to wildlife, especially not necessarily direct exposure, but we know that there's going to be urine in puddles, that many wildlife animals are going to drink out of puddles in creeks. And so things like leptospirosis are in our vaccine protocols anymore for all dogs, because if you live in the woods, there's going to be an opportunity to have wildlife passing that disease around. And if you live in a really urban setting, there's going to be some urine in puddles, be it from rats, be it from other dogs. And so the exposure is for everyone now on things like leptospirosis. And that is one of the vaccines that I'll make sure to protect dogs against. Lyme disease is also in our vaccine protocol as a lifestyle vaccine. So to define that, we talk about core vaccines as the things everyone who is a dog or everyone who is a cat should be protected against. merely by being a dog or a cat. Then we talk about lifestyle vaccines as those who have more exposure or are more at risk if they get the disease and would need this protection. And so there's a few that we run through based on that history and what we learn about the dog or cat.
Mhm. It's so interesting talking about this, and you made such a good point about, when you bring a dog into your home and then you bring your dog into the nature reserve, you're kind of bringing the nature reserve into your home. And if you have cats or kids, maybe they could be exposed to things even without going there. Do you have any stories of a time when an entire household has been impacted by one animal?
Oh, I do. It's a little bit gross, but I will share it with you. I had a client bring in their dog who had had some really runny stool for a couple of days. Uh, was a big outdoor hiking dog, big fan of being outside. They did several miles a day, and I think he was a 2 or 3 year old, 45-pound dog, very healthy. I had seen him, gotten to know him a lot through puppy vaccines and visits, but he didn't have any chronic conditions or health concerns. But he had just a waterfall of diarrhea, and so he came right in to see us, and we
No.
diagnosed Giardia, which is a waterborne parasite, very
Okay.
easy to get from drinking out of creek water or anything outside. And as I described the signs and what we could see happening, they had the client had mentioned, I think my other dog has a little bit of soft stool beginning. It wasn't as bad as this one, and so I only brought in this one. And as I got further into describing what the symptoms can be like with Giardia, the husband and wife just made eye contact with one another and said, I think we have this too.
Oh
So I sent them off to their
no.
human physician, but Giardia is a classic example of something zoonotic that passes easily between humans and animals. And though these humans did not drink from a puddle, they lived with a dog who did.
Wow. What a cautionary tale. So, I mean, I'm really glad that they were able to come in and see you and then learn something about themselves. But yeah, it can be a whole household impacted by these lifestyle activities. Wow. I actually have a cat who loves to go outside too, Ferguson. He is a little spry orange tabby cat who like begs to go out on walks, and I put him on a little harness, take him out on the leash. Um, are there any risks that you would say for cat people who are taking their cats outside specifically that would apply to the cats?
I'm glad Ferguson has his harness and gets to go outside. I think it's so fun for cats to get to exhibit those behaviors and be outside. But I also think boundaries for them are really important because it's easy for a cat to get lost or not know where they are once they get just a little ways from home. Especially if they didn't mean to get outside. But if you do have a cat who likes to go on a backpack or in a stroller, on a harness, or even is an indoor outdoor cat, we do think a little bit more about one other vaccine for them called the feline leukemia vaccine. Cats have two core vaccines that they're at an exposure risk to just by being a cat, and feline leukemia is spread cat to cat. And we call it the nice kitty disease because they get it from grooming one another, just interacting with each other in a pleasant way. And so a cat that goes outside is going to go meet some other cats potentially, and we want to make sure they're protected against feline leukemia if that's the case. I always am going to want a cat on parasite control, especially because these tiny little things like mosquitoes can get in the house. I've seen a mosquito in my house fairly recently. So being an indoor cat does not mean that a vector for disease can't come inside either, but especially if they're going to be spending time outside, we want to make sure that a tick is not going to find a home on them for more than 24 hours and pass on any diseases, and that we're going to limit the chance that mosquito bites them and passes heartworm disease, anything like that.
Hmm. And I know that there are certain things that are more regional in nature, and I I do a lot of traveling. I don't always take my animals with me, but occasionally I do take an animal with me, and I've had to really think, okay, if I'm going like I'm in Southern California, but what's happening in Texas or Pennsylvania looks different than what's happening here. Can you talk a little bit about traveling with animals and how people should prepare for their animal to travel, and like should they reach out to a vet if they're going to be taking them to another region?
Travel is one of the areas where I think it is most obvious to me that dogs and cats are more integrated into our daily lives because they're coming. They're coming on our trips. They're coming when we move somewhere. And we do have to think about one, how to get them there. And so we want to partner with you if you are traveling with your pet to make sure that even all the documentation is appropriate to get on the airplane to cross state borders or international borders. There are USDA regulations and things that take a good amount of preparation in order to travel. So as soon as you know that you are headed somewhere, it's worth putting a phone call in to make sure you know how many months in advance and what steps need to be done to get your dog or cat to come along with you. But I think asking as well, once we get there, what should we be on the lookout for is extremely wise. We need to know where you've been, but it's worth asking, hey, where I'm going, what should I be watching for? I think heartworm disease prevention is a great example of that. Places like Mississippi and Louisiana and Florida and the Southeast have a 12-month mosquito season. And so their heartworm disease population is higher. And if you come from Alaska, you're going to want to make sure that you're prepared with heartworm disease protection.
Aside from travel being something I think people don't always remember to talk to the vet about, I also think a lot of people don't associate the food they're feeding their animal with a conversation that they would have with their vet. I think people kind of are like, okay, food for my cat or dog is something that I pick out from the store and I feed them. And it's not necessarily a conversation that they plan to have with their vet. But could you talk about that?
Nutrition is so core to the health of the animal, and it is one that we could all spend a little more time talking about, right? When we're gathering a history, we ask if the pet is eating normally. Hopefully, on a good day, we ask what they're eating. But a veterinary nutritionist is going to give you a 5-page document asking for everything that passes the lips of the dog and go much more in detail. And that's because they know how macronutrients are affecting them and what the calorie count should be and those things. And they're using that as the building blocks of the health of the animal. And I would love for more and more pets to avoid disease, avoid excess medications just by being on the right food. So the first thing that I think we all can do is bring that conversation back to the veterinary hospital. Dogs, especially, there's a ton out there. And we just want to think about the category that your dog falls into. Are we working on weight management for the dog? Are they growing? Are they a hyper athletic dog who needs a lot more protein than the average dog? And so, what a veterinarian can supply you with is that what you're looking for category. You're looking for a large breed
Mm.
active dog diet. There are prescription diets. And so, if a dog has a diagnosed condition that would be food responsive, they would do a lot better on a particular food, short term or long term. I'll partner with you to write that prescription, help you find the food, help you transition to that food. And that's really a lot more of the food as medicine side of nutrition.
Mhm. Yeah. When you have people who have just adopted, let's say, a new kitten or a new puppy, are there any common mistakes that you see people making when it comes to diet in the first, let's say, like year of their life? Are there things that you see people choosing the wrong thing?
The most common thing that I have to myth bust a little bit for owners in their first year of the dog or cat's life is the quantity that the pet needs to eat. It
Oh,
seems like
interesting.
such a small amount when I calculate it out for you and I say, hey, your cat's daily calorie intake is 185 calories to maintain their healthy weight. That's not very much, but you have an 8-pound cat. And so, more often than not, we are loving our cat so much that they get 10 treats that each are 4 calories, and then they get their dry food all day long, and then a dollop of a quarter cup or maybe a half cup of wet food. And all of a sudden, they're being offered twice to three times as many calories as they need. And eventually, they'll
Hmm.
adapt to that and start to think maybe that is as much as they need to eat. They'll beg for more. And then we're on this slippery slope of adding more and more calories to a cat who is finishing up their growing and getting a little bit more sedentary in their lifestyle and actually needing fewer calories than they used to.
How can people discern good advice from maybe advice that is not the most accurate information? Where should people go to get solid information about their animal's care needs?
The internet is okay to use. And what is hard is not having that open communication between client and veterinarian. So if you saw something on the internet that scared you, I just need you to come to me and say, I read this thing on the internet and it's really freaking me out. And then we can talk about it and I can help you see which parts of that are truly scary for the animal in your home and which parts of that are not applicable to your home. And so I think it makes definite sense to look something up and then to bring it up to someone who knows you and knows your animal and knows the goals that you have for them. Going to websites that are recommended by the veterinary provider can be really helpful for both client and our veterinary team because we know it's the same information that we would give you if we could talk it to in the morning also. There are also available resources like at Banfield Pet Hospital, we have Pet Chat, which is 24-hour access to a veterinary professional through instant chat. And so you can ask those questions. Is this a big deal? Do I need to head to the ER? Or is this product something that I should build into my regimen? So there's ways to reach out to veterinary professionals now with technology as our aid that we didn't have before that help a lot too.
That's really cool. I love that. You mentioned kind of like the stress and feeling like scared of things you might read or advice you might be getting. I think another scary thing for a lot of people is just the cost that comes with, getting care for your animal. How do you have those conversations about cost? And what do you recommend to people who are trying to figure out like what they should prioritize if they might be on a budget?
So when we talk about cost, I lead with the information that I want the client to have, the value of the things that we're offering as care for the animal, what we'll gain from that, the risk of not doing it, and then the cost associated. And I try to make sure to say, I wouldn't give you two options if there weren't two options. And if there is only one option, that is
Hmm.
the one, regardless of cost, that will be offered. But we are customizing care and we are customizing it to what the pet in front of us needs and what the human at the end of the leash or next to the cat carrier needs as well. So I want to remove that bashfulness for clients to say if I bring up
Mm.
cost, it means that I care more about money than I care about my pet. I don't know any veterinary professionals who think that if you ask about cost. We want to provide that information. We want to make sure you have everything you need to make a good decision for what keeps food on your own table and takes care of the animal that you've entrusted to us. And we should all have that transparency to say, if I have this much that I can set aside for my pet, how should I use it? And I'd love to be given a budget and told prioritize what this pet needs. And that's where I think making a plan when you have a healthy pet in front of you for what's going to happen if they get sick or how we're going to keep them from getting sick is the best move.
Now, I hear people kind of talk about pet insurance and wellness plans and kind of the confusion that there can be around that. Can you talk about the difference between a wellness plan and pet insurance? And do you recommend one or the other or both?
Pet insurance and wellness plans are different, very complementary. A wellness plan is
Hmm.
for the predictable and the preventable. So at Banfield Pet Hospital, we have wellness plans that cater to puppyhood and kittenhood, all the way up through our new senior care plans that are much more robust in their diagnostic offerings to make sure that we know everything we can about senior pet years and keeping them healthy as long as possible. A wellness plan is going to be a bundle of services that every pet should get in a 12-month span. Those vaccines and parasite screenings and baseline blood work, things that you would choose for your pet, bundled up together into a package. That is going to be different than pet insurance, which is there for the unexpected and the emergency. Pet insurance has the ability to be customized to include some wellness care, but by far and away, pet insurance is there for the unthinkable and covers often 80 to 90% of the cost associated with that big health concern that came up out of nowhere. To have pet insurance, you're going to pay a premium and a deductible, just like we do in the United States healthcare system. To have a wellness plan, you're likely going to pay for the services that that pet will receive at a discount with some additional benefits offered in as well. So a wellness plan is the best way to kind of decide once that we're going to follow the health plan that we want for our dog or cat this year, and then not have to redecide every time or have the cost conversation every time that they're in during that year.
Have you seen a case that was impacted by those two supporting things, the wellness plans and the pet insurance? Do you have any cases that you're like, oh, thank goodness they had those in place?
I've seen cases where we certainly utilized a wellness plan and pet insurance together, and we're really grateful that both existed. I would say every day I see tons of wellness plan patients, and I'm so grateful that that is the model of care that we're able to deliver. But every now and then, the pairing with pet insurance really makes the biggest difference. So we had a dog come in often with their wellness plan. We knew him well. He was a 2-year-old lab. The life of the party everybody enjoyed when Rufus came in. But he came in one day on a more emergency basis and had jumped out of the moving truck and was limping. And so we needed to know kind of the severity of his injury and what to do now with this acutely limping dog. With his wellness plan, we were able to sedate him after looking at his blood work, making sure all looked good, and get some radiographs. And those x-rays showed that he had broken a part of his tibia and was going to need some plates and orthopedic surgery with a specialist that was not going to be provided at his home hospital. And that is when pet insurance kicked in. So he didn't have any pre-existing condition. He was well covered on his pet insurance. We accomplished the diagnostics with his wellness plan and then got him into the right hands for that specialty care at a cost that the client could afford because of their premium and deductible with pet insurance.
That's an amazing story. And it goes to show like the importance of having that established relationship with your regular veterinarian that you're going to for routine care. It sounds like they knew exactly what to do and had all of the pieces in place. So, we're going to wrap up with Tales from the Clinic. This is an opportunity for you to share a story. And I'd love to hear a story about a time that maybe a first or an early vet visit was able to uncover something important that they wouldn't have known without going in for routine care.
Sure. I'll tell you the story about Dakota. Dakota is a sweet 4-year-old hound mix who was adopted just a week or so before I met her. And Dakota came in not really seeming as though she was going to need veterinary care that day. So her new owner had brought her in to just say, "This is Dakota. She's new to my family. What do I need to know?" The place that she had adopted her from did vaccines. She's up to date on things. She's already been spayed. I just wanted to introduce her and get to know the veterinary clinic down the road from me. And so we discussed everything that a healthy 4-year-old dog was going to need for the year. And so we put Dakota on a wellness plan that was going to include her vaccines when they did come up due toward the end of this year, but also some fecal parasite screening, her routine blood work, heartworm and tick-borne disease testing, office visits whenever her owners needed them over the next 12 months as they got to know her. And so we built that plan for her and decided to go ahead and get that baseline information that we didn't have on Dakota today by doing her blood work. So Dakota had come in really healthy, normal physical exam, and was just so calm and quiet and sitting next to her owner under the bench. We ran her blood work, her organ function looked good, and her heartworm and tick-borne disease test was positive for heartworm. And there's no way to know that a dog has heartworm unless you run that heartworm test. And we didn't know Dakota well enough to know that her being quiet and sitting in the corner under the bench was really lethargy for her. It wasn't her normal personality. And her new household family members couldn't know that either because everyone was just now meeting Dakota. So we got that diagnosis so much earlier than if we had waited for her to develop a cough, exercise intolerance, essentially go into heart failure. We would have been way behind on treating her and probably unsuccessful in treating her. So instead, Dakota had this wellness plan where she could come in anytime she needed to, and you have to come in a lot when you're getting treated for heartworm disease. So we adjusted her protocols to make sure that we could get those worms out of her system before there were changes to the anatomy of her heart, before she had long-lasting damage from that. And I remember when Dakota came to get cleared of her heartworm disease to run that test again and make sure it was negative. And she was rambunctious. You could not calm that girl down to draw the blood to get the test. She was like a puppy, and we had no idea that's what was inside Dakota as far as personality goes. But her life was saved by getting adopted that day and by going on a wellness plan.
I absolutely love that story, and congratulations on your success, Dakota's case. I love that. Thank you so much, Dr. Thompson, for joining us today. I've really enjoyed chatting with you.
It was so fun to talk to you, Hannah. Thank you.
Thanks for joining us on this episode of Not Just Fluff. And huge thanks to Dr. Elizabeth Thompson for walking us through the building blocks of a smart care plan. Whether you're juggling kids, outdoor adventures, or just the chaos of everyday life, remember, preventive care isn't about doing everything at once. It's about making a plan that works for you and for your animal friend. So take a deep breath, lean on your vet team, and know that you are not alone in this. Thanks for listening, and until next time, give your cats and dogs a little extra love from me.